Hey guys, this is Sarah. I am doing my presentation over the bones and joints. In geriatric patients, the balance of formation and absorption changes as osteoclasts break down more bone than osteoblasts are replacing. As this happens, the content of minerals decreases and bones lose their density and become fragile. Cartilage between bones degenerates and becomes thinner with time and use. The ligaments connecting the bones become less elastic and cause joints to become stiff. This reduces motility and flexibility. There are a few things you will most likely observe upon assessment of a geriatric patient. A geriatric patient's trunk becomes shorter as vertebral discs become thinner and the vertebrae lose their mineral content and break down. These changes cause the spinal column to become curved and compressed. Bone spurs may also form on bones. Extremities may appear longer when compared to the shortened trunk because long bones do not shorten and compress as the spine does. The arches of the feet also degenerate and cause further loss of height. The nurse should examine joints for tenderness, swelling, warmth, and redness. Presence of osteophytes on distal joints are known as Heberden's nodes. If osteophytes appear on the proximal joints of the fingers, they are known as Bouchard's nodes. Both of these are associated with arthritis. The nurse also evaluates passive and active range of motion to determine flexibility and movement. Limitations to activities of daily living are also questioned and evaluated. Osteoporosis is caused by low bone mineral density. This disease results in brittle, fragile bones. Osteoporosis can be primary, which is considered part of the normal aging process, or secondary. Secondary osteoporosis is caused by medications such as steroids or other diseases. Osteoarthritis, a degenerative joint disorder, is the most common type of arthritis. In this disorder, the cartilage within a joint is damaged and becomes thin. This causes bones to rub together, which creates inflammation and pain. Osteoarthritis results from many factors such as genetics, strenuous use of a joint over time, and localized inflammation. Rheumatoid arthritis is a systemic autoimmune inflammatory disorder. In RA, cartilage and bone are destroyed within joints due to T cells and macrophages produced from the inflamed joint lining. A common characteristic of RA is symmetrical pain and swelling of multiple joints, most often small joints. Gout is a type of inflammatory arthritis and is caused by the accumulation of uric acid crystals within joints. Gout is extremely painful, often too painful to touch, and is red, purple, and hot. This form of arthritis most commonly infects the big toe, but can appear in other joints as well. A diet low in purine and alcohol can help to decrease attacks. Education of the geriatric patient is key in helping them to achieve the best quality of life. Exercise can help strengthen bones and diminish the progression of bone loss. These workouts should include weight-bearing aerobic exercises, such as walking and weight training to maintain bone mass. Stretching can help to maintain joint movement and flexibility. There are many changes that occur in the bones and joints of geriatric patients, but with the correct education and follow-through, many of these changes can be managed or delayed.